Perhaps Alessandra. Okay, Alessandra, can you tell us a little bit more about what kind of activities you expect from the Young WWF in the future? You had a sort of call up for all the young people in this room, and what kind of things do you like to do?
Well, first of all, thank you very much, and I have to say that I'm quite excited for this meeting, and because the EOF, I think, is a great opportunity to share perspectives, opinions on very important manner. It's more than talking about assertive outreach and community care. It's talking about to the earth of problems of mental health in Europe. And this is really what in the group we are trying to develop. We are 6, as you could see all, and it's like we are building a relationship of trust among each other. We are exchanging our perspectives and our ideas, and I think that first of all we are improving as professionals, but as person too, because it's a very an experience for growing up. So the future, considering these roots, I think that the future will be to increase the number of our group in order to have the chance to really share more and more perspectives, to create a stronger network, maybe able even to talk of these very important topics at always more important levels in the European societies. Because yes, we are in some way the future of mental health. And so I think that if we are going to be a strong network, we are going to have really more opportunities to increase recovery, self-determination, empowerment of in community care. That is very, very important for all of us.
Okay, and I think we are in good hands with the president and the vice president from Italy, because I think when it's up to community mental health, you have a long history of another kind of community mental health and in a lot of other European countries. So I think we can learn a lot from you, the people from Italy. So please stay with us together, and yeah, and I think it's very important for all your professionals to get notice of the practice of your country. So thank you, Alessandra, and we see you again at the item about Italy at the end of the program. So we're now going to the Dutch contribution. Can I go on, Niels? I think so. Your mic is off.
Yes, please, go on.
Okay. So I'm now going to introduce our Dutch contribution from GGZ Drenthe, a mental health service provider in the northern part of the country. And I would like to invite Jasper van Marle and Annelies van der Heijden. Perhaps you can come with us on the screen.
Perhaps we can also start with the... Oh, okay, they are already coming.
Jasper is here, and I've seen that Annelies is also attending the meeting. Hi, Jasper. Good to see you. Okay.
Hello.
Yeah, hello. And Annelies is also there. So we can start with the movie from your... I think your new project from the last few years, and afterwards we have a sort of interview about how do you get there on this practice at the moment. So let's start the movie from GGZ Drenthe.
Optimal Living is an integrated care network for people with severe mental illness located in the Netherlands. With a recovery-oriented, solution-focused approach, we offer more than just support, psychotherapy, and medication. We also help people in their daily lives by supporting them socially. Our team works in close collaboration with addiction experts, supported living, and mental health workers. By doing this, we integrate formally segregated disciplines. This has proven to be a significant advantage for both our clients and our teams. Optimal Living is a cooperation between different organizations specialized in mental health care, addiction care, supported living, and social work. We focus on collaborating with general practitioners, police, healthcare insurers, social services, housing corporations, but most importantly, with our clients, their friends, and their family members. Our aim is to empower people with long-lasting psychiatric vulnerabilities and improve their quality of life.
Combining mental health services with social services for improving the outcome of the patients that they have in their care. And it's really a good example of how care can be improved by really combining forces of the mental health services and the social services.
In the past, our clients regularly received care from a number of different organizations who all operated individually. By uniting these different entities in one team, we have resolved past inefficiencies. In our integrated teams, we offer specialized care in as many different areas of life as necessary. Individualized treatment plans are evaluated and coordinated during daily team meetings. Our teams consist of psychologists, IPS specialists, specialized nurses, peer workers, family therapists, case managers, psychiatrists, addiction specialists, etc. Peer workers play an important role in keeping our focus on recovery and empowerment. Intervening simultaneously in multiple areas of life is essential and beneficial for our clients. Integrated care connects the dots while maintaining high levels of expertise. Together with our clients and their loved ones, we explore strengths and vulnerabilities, as well as talents and wishes in order to improve quality of life. Our recovery planning always starts with asking clients what their plans and goals are. Questions like, what happened to you? Where do you want to go? And what do you hope for? Treatment and recovery goals are always based on answers to those questions. Our locations are community centers, close to where people live. This way, we are easily accessible to our clients and to collaborating organizations involved with our clients. Collaborating in one team with addiction care, public organizations, and supported living organizations increases the ability of clients to recover and participate in society. We do our very best every day to create an environment that is caring, involved, empathic, and accepting. From a recovery point of view, we try to restore hope, help people find their way in society, and retrieve their identity through coping with their vulnerabilities. Optimal Living is a successful initiative which allows clients with chronic mental health issues to make lasting changes and improve their overall quality of life.
Okay, Jasper, thank you for this movie. And I have a question for you, and I'm waiting for Annelies. And Annelies, could you put on your screen, your camera? Yes, there is Annelies. Okay. Perhaps it's good to introduce yourself, Jasper, shortly, and Annelies.
My name is Jasper van Marla. I'm working as a psychiatrist in a small city in the north of the Netherlands in a team called Optimal Living, an integrated care team.
Okay, and Annelies, who are you? Your microphone is still...
Yes. Hello, I'm Annelies van der Heijden, and I'm working in Assen, which is the capital city of our province, Drenthe, for Optimal Living, as an experienced worker.
Okay, so Jasper, you have attended, I think, all our conference the last 10 years, and could you tell us a bit more? How do you get the first impulse to start this project? Has have you learned from other countries, or what was your first thought about, okay, that's the way we have to go? Can you tell it about this?
I will, but first let me thank you for the honor of my team to be representing our country in this this small conference. And I was very sorry that the conference in Leuven couldn't go on, because I've been attending it since the start, and if you ask me to tell a bit, that's a bit difficult, because there is so much I learned and saw. First of all, it's the meeting of all the likewise-minded people that's very important for me, and the networking that you can do, and seeing all the different solutions to problems you experience in your own country too. So that was one of the main things. But the thing that struck me the most is that I found that the basic of everything we do is making sure that you can continue the care for our patients. That's one of the most important factors you need to organize to be efficient in delivering care. And that's also one of the things that we try to do in our new project, where we integrate all these different services and try to be there for our patients over a longer period of time, to make them have the changes in their lives they so much seek for. And especially the time we were in Oslo was the moment that really started off for me the thinking about integrating the social services. We had a small conference there. I still remember how it was only 5 of us, but it was a very important moment for me in my career to get the notion that all our people mostly need the social services. That's one of the basic things. And as long as you organize their housing, their social problems with their families, their financial problems, then you're able to make them start recovering and start treatment they need. And if you don't, it's still difficult for them to engage in these activities.
There's a question in the chat, Jasper, and someone asks, can you tell us what the difference is with the FACT model?
It's not so much a difference. I think it's continuing on the thinking of FACT as we did from the beginning in working with FACT. The biggest difference is that we integrate housing teams with addiction teams and mental health teams in one group, which was in the past still is in the Netherlands a big problem, because people get bounced around between those services and miss the integration and the communication between these teams. And we try to overcome this.
Okay, and can you tell us a bit more about the reaction of the other institutions, like police or housing services or the local community? How are they reacting on your project?
Good, I might say. They missed us in a lot of situations, and now we're easily accessible for them. We even sometimes I come walk in the building I work in, and then the police is sitting there, and we are so close to that they're having a sort of a public place there where people can meet the police, and just see them sitting there, and sometimes they walk up to us and come to talk to us. So close are we to the community, which I think is very important, and they appreciate this.
And how is your relation with the GPs, with the general practitioners, the home doctor?
Also very well. In the past, there were so many GPs I was working with. I couldn't know them all, but now I can really build on the relation with them. I know them all. I have their phone numbers. They have my phone number, and we sometimes even have meetings where we discuss our patients. So we are very close to each other, and we can easily interact, which is a lot more efficient than in the past.
Okay, great to hear. So before we go to Annelies, Jasper, I think we all expect a beautiful presentation in 2 years in Leuven because then you are 2 years further on, and because your project is only in a few areas, it's not the complete area of your organization. Is it?
We're 3 teams, and we're starting a 4th team now in Bijlen also. But no, we're a small project in the Netherlands. Yes.
Yeah, but it's
but
very.
We will have a presentation. You can count on it.
Okay, great. Okay, let's go to Annelies. Annelies, can you tell us a bit more about your influence as a peer worker in the teams? What's your role and what's your influence on your colleagues and so on? I think you have to unmute yourself.
I think working with your experience is very important in the teams because from my own experience, I know what it is to have to look to different disciplines and how they work together. And so with all my experience I went to school to be a professional in this, and working in a team now is making that I can I translate between patients and clients and professionals, building bridges, telling what it is to have another mind of view, see other possibilities, and I think that is a great value in a team.
And are you the only peer worker in your team, or are there more?
No, I work with my colleague, male colleague, together.
And what's the reaction of your clients about that you are part of the team?
They're very happy with it because sometimes you go with them to a psychiatrist when they have the feeling they cannot communicate together. So I think it is very important to have to translate, to build different parties together, to look out of the box, to work out of the box sometimes, because it's not only what you want and what your goal is, but what do you need to start it.
Okay, that's great. And when you look to the future, we are running out of the time now. What's the most important wish you have for the future?
I wish for the future that there are coming more teams like this to combine working all that kind of professionals in so different ways to make it simpler and easier and more honest for the patients to go back in society. And it is very nice that Alessandra told something about Italy, because I went to Italy for my study, and I went to San Padriano, which is a very large community of people who are working with their experience, and to see how normal it is and it can happen to everyone. It is very nice that you can work with it.
Okay, thank you, Annelies. There's a last question for you, or maybe for Jasper. How was the experience for you, Annelies, for the connection between the mental health services and the social services?
I think the social services and the mental services are very happy to find each other, at least because it's taking less time, less money to find each other, which is a benefit for all of us.
Okay, I think that's the best slogan we can end this interview. It's now 40 minutes now, so I think we go to Niels, and Then we go on to Spain, isn't it, Niels?
Yes, that's correct.
So thank you,
Very much,
Jasper and Annelies, and
Jan.
see you again in Leuven.
Thank you, Jasper and Annelies. And
Thank you also very much.
I think the conclusion from for Annelies that integration of social and mental health services makes that people make better connection. It saves time, it saves money. That's a very important message, and that's probably one of the lessons we can learn from the project in the Netherlands. That this integration is really very important. As Jasper said, it was an inspiring moment for him when he realized that a couple of years ago. Many countries are struggling with this issue. So then we go on to the place where we had the next conference, which was in 2013. It was in Spain, Avilés, a village in the northern of Spain. Beautiful village, beautiful conference site. And Juanjo Gambrina and his team, who are working there already a couple of years, many years, are building community mental health services, which spread out throughout all of Spain, as I've been told. And we are very happy that they send in their little movie. We'll start with the movie, and then afterwards we'll have the discussion with the Italian team led by Margaret Overdijk. Could you start the movie, please? Spanish movie, of course.
La sanidad pública debe dar una atención de calidad a todas las personas independientemente de su condición social o biológica. Marina, sin embargo, es un caso especialmente complejo que requiere una mirada diferente.
El equipo de intervención en crisis se dirige a realizar una visita domiciliaria a una paciente grave que llevamos desde hace unos meses tras el alta de la unidad de hospitalización. La paciente presenta un trastorno obsesivo grave y en el centro de salud mental se decidió derivar para ingreso hospitalario, puesto que se habían intensificado mucho los síntomas de angustia, ansiedad, estado de ánimo bajo y autolesiones diarias que incluían incluso la cara. Durante el ingreso se planteó la posibilidad de prolongarlo incluso más meses, pero la paciente y su familia expresaron el deseo de recibir el alta hospitalaria. Y dado que el mantenimiento del ingreso no necesariamente suponía una mejora en su evolución clínica en ese momento, se acordó realizar un alta con un seguimiento inmediato, posterior, intensivo por parte del equipo de intervención en crisis. ¿Qué tal estás durmiendo? Porque,
Duermo más bien.
o sea, que ya no despiertas a tu hermana que duerma al lado,
No,
al lado
ahora
tuyo.
duermo bien. Hay días que despierto a lo mejor a las 2 o las 3 de la mañana y levántome, pero son los menos. Sí,
¿Y cómo van tus ideas y tus pensamientos? ¿Sigues con alguna idea de
Sí, que la cabeza no me deja, ¿eh?
hacerte algo de daño?
Sí, estoy otra vez,
de
sí.
sentirte poca cosa.
Poca
y
cosa,
eso.
muy poca. No me siéntome como un trapo, no siéntome como nada.
¿Y te volviste a hacer daño?
No.
¿Eso conseguiste controlar?
Sí, conseguí controlarlo.
Porque hace meses te acuerdas que lo pensabas en casa incluso.
Sí, yo me
Y que incluso tenías ganas de morir.
Tengo, me pido cuando voy al cementerio, llego y digo yo, mamá, ¿por qué no me lleves contigo? A mí poco me quieres. Digo así, y pido a Dios también. Digo yo, lléveme, ¿por qué no me lleven? Y te van a morir. Sí.
Bueno, yo creo que, ¿te acuerdas que lo que hablamos es que tienes que... Tarde o temprano será, pero mientras tanto ella estaría contenta de verte mejor, de verte que estás tranquila en casa, que tu hermana te cuida como ellos le pidieron. Y yo pienso que eso es lo que hay que hacer, ¿verdad? ¿No te tranquilizas pensando eso? Que ellos, tu padre y tu madre estarán pensando eso. Que tienes que estar tranquila en casa, ayudar a tu hermana.
Lo importante es eso, que estéis las dos más tranquilas y retomando un poco la rutina que vosotras soléis tener.
Y gracias a ustedes estoy como estoy, ¿eh? Gracias a ustedes que vinieron día por día. Eso yo agradezco mucho porque ayudaronme mucho. Dígolo a todo el mundo que me lo dice, dígolo. Digo yo, gracias a los psiquiatras que vinieron a mi casa. Sí, dígolo.
Nos gusta que nos lo digas.
Cuando lo preguntan, digo yo, gracias a ellos estoy como estoy.
Es que tú en el hospital lo pasaste muy mal, ¿no?
Muy mal, sí. Y eso que me trataban bien, ¿eh?
Ya, sí, claro, porque son profesionales, pero...
Pero tú querías estar en tu casa.
Sí.
Claro.
Sí, de ellos no tengo tampoco queja porque trataronme muy bien.
Hombre, ellos intentaron ayudarte en todo lo que pudieron todo el tiempo que estuviste allí, pero...
Sí.
Fue necesario, ¿verdad? Porque estabas muy mal.
Fue necesario que vinieran ustedes, muy necesario fue. Y yo agradezco lo mucho, que me ayudaron mucho.
Cada vez que lo necesites estaremos para ayudarte.
Sí.
Es nuestra intención evitar que pues a lo mejor tengas que volver a ingresar o cualquier cosa y entonces podemos intervenir y es un poco el deseo que tenemos.
Sí.
Que no lo vuelvas a pasar así de mal.
¿Y el estar aquí metida en casa?
Muy bien.
Estás mejor ahora cuando estás en casa, ¿eh?
Sí. Yo en casa estoy mejor. Fuera, véome como si fuera un trapo, como si fuera no sé qué, y estoy mal. Y aquí en casa estoy bien.
Lo más importante que me gustaría resaltar es la importancia de disponer de diferentes recursos con una adecuada coordinación en el contexto de un abordaje multidisciplinar de la patología mental grave.
Las intervenciones domiciliarias han demostrado una potencia superior al resto de entornos. El domicilio es el ámbito donde más se respetan los valores del paciente. Los dispositivos asistenciales deben adecuarse a las necesidades del paciente y no al revés.
I just don't know what to do with myself. Don't know just what to do with myself. I'm so used to doing everything with you, planning everything for two. And now that we're through, I just don't know what to do with my time. I'm so lonesome for you, it's a crime. Going to a movie only makes me sad. Parties make me just don't know what to do. Like a summer rose needs the sun and rain. I need your sweet love to be all the pain. I just don't know what to do with myself. I just don't know what to do with myself. Baby, if your new love ever turns you down, come back and I will be around, just waiting for you. I just don't know what to do.
Margaret will take over from here.
Yeah. If I get, if I can get in there, but okay. I think I have no view. No, I cannot share my video. So Lodewijk, can you look at that? Juanjo.
Hi, Margaret.
Hi, Juanjo. Great to see you again. Although it is just on screen, but we saw you, I think, in all the conferences of the EAOF in the last 10 years. Yeah, you've become a great friend of ours. And I think so is your friend, your colleague, Alberto Duran. Welcome, Alberto. Hi, great to see you. And Stefan Forst from the Young EAOF is sharing us in this small interview we have. Well, I think I can speak for the audience, and Marijke also put it in the chat. What a great movie, Juanjo. Very touching, I think, spot on. This is exactly what it is about that you can ethically value more the demands and the wishes of the patients, the clients in their home situation. I think this is really what our community care is all about. I know you came a long way in Spain, and I follow you on LinkedIn. I try to translate your Spanish messages in Dutch, and I think there are a lot of developments in Spain at the moment. Can you tell us what was from, what was it, 8 years ago when the conference was in Avilés? What were the main developments, and what do you think was the main payoff from the conference we had in Avilés with the EAOF?
Margaret, this question Alberto is going to
answer.
Okay, to answer.
Okay, Alberto.
Perfect. Okay, we organized the European Assertive Outreach Congress in 2011. We had a lot of experience in organizing monographic congress on assertive community treatment because we already organized 9 congress in Spain on this topic. Yeah. But the European Congress was something very, very special and very important for us. For the development of community mental health in Spain. In my opinion, there is one before the European Congress and there is one after of the European Congress for assertive community treatment teams in my country. Before the European Congress, there were few assertive community treatment teams in Spain, and these teams worked very differently. After the European Congress, a lot of new ACT teams were created. And this team started to work in a more similar way. I think this is very important for me, for the model of the treatment. For the professionals who worked in the ACT teams in Spain, it was very important to be able to meet professionals from other countries who worked in homes of patients. It was very positive that professionals from all over the world told us how they work in their countries. for me, in my opinion, the Congress was very, very positive and served to promote homework in the mental health services of Spain.
Yeah. Okay, thank you. Yeah, I think so too. That's the idea that I had, that it was really important for your country and all the developments in your country. Yeah, it's great to hear that it also had influence of the way of working of the teams, that they work more standardized, more in the same way. That's great. Yeah. There was also a question in the chat about working at home with the patients, and it was how the neighborhood or how the community even more react to those people in the community and in their own homes, because that's a big issue in the Netherlands, for instance, but I can imagine in more European countries. Can you a little bit reflect on that, Alberto or Juanjo?
Yes, we have a very good experience about this question, because when we began working in an assertive outreach model, population were afraid of our intervention in the patient's home, and it was a problem. But day after day, with our work, we have changed this stream, and nowadays population is like external other support for our work,
okay,
are encouraging us to continue in this way. When people notice that mental health service is working with patients, people collaborate with mental health workers. But if people is not engaged with our presence, our contact, our daily contact with patients, they went out. Then, but
okay.
It's possible, and it's very, very encouraging for us. This
That's really, really good to hear, Juanjo. I think that's a great topic also for the next conference in Belgium, to elaborate more on that.
Okay.
I would really like to hear from Spain how you managed to do that and how you managed to have that influence on the community.
Okay. Okay.
Yeah?
I think it's a good idea.
Yeah, it would be great. Would be great.
Okay.
Stefan, can you ask the next questions to Alberto and Juanjo?
Yeah, absolutely. Thank you very much, Margaret, for the opportunity. And Juanjo and Alberto, thank you very much for your beautiful presentation. I think after 2013, you achieved quite a lot, and I hope you reach your goals. But as we know, it is always work in progress to keep the development going on. Is there something you have, what a certain goal for you is for the next coming years?
Yes, because we need to improve our the composition of our teams, the structure of our teams. We need to engage more patients in this kind of model of intervention, and we need to close the gap where in Spain 30% of patients with severe mental disorder are lost, are living in the streets, in jails, and that's not the place for them. We need to spread the model.
Yeah.
Thank you very much. I think that's a great and a beautiful goal to try to work on for the next coming years. Thank you. Thank you very much.
Okay, thanks.
Okay, Thanks, Stefan, for your questions. Yeah, I'm at the airport now at the moment. I'm visiting my daughter
Okay.
for the first time in 1.5 years. So
Okay.
really
Good flight.
excited. Yeah,
Bye,
that's the
Margaret.
noise you hear. Okay, yeah, thanks a lot, Juanjo and Alberto, and we hope to see you in Belgium.
Okay. Thanks.
Bye. Bye.
Bye.
Niels?
Thank you, Marijke, Margaret,
Margaret, yeah.
Juanjo, Alberto, Stefan,
Hey.
for this event, and also for the really beautiful movie. I enjoyed it a lot. Right, like Margaret said, it's spot on, and also what you reached with this specific patient is impressive, and getting the community involved and having them more accomplished too. That home visits are the way that we normally work. I'm surprised that you did it, and you are very consistent on this over years and years. Juanjo and your team, you're pursuing this goal. I admire that a lot in your team, because it takes time, as we know. This is not done in an afternoon. It takes years to transform the system and get everybody on board. So my compliments for that. I'm very happy to hear this. Thank you very much.
Thanks a lot.
Yeah, of course. We'll now go to have a short break.
Yeah. One thing, Niels, only one thing. All this work is made because there is a very great and good team of professionals working together in Spain, mainly in Avilés, but I think is they are the people who have been able to develop this model.
Yeah,
some people have been guiding this or traveling more than others, but I need to remember all of them. Okay,
yeah,
thanks.
I remember always, Juanjo, you come with a team. You never come alone.
Okay.
So I guess that's the strength of the Avilés model, that it's teamwork, it's together, it's sharing all the difficulties and the juice and things to achieve together. And it's really an example of teamwork, not of only treating patients as a team, but also developing services as a team.
Okay.
I see that in Avilés, and it's a good example indeed for all of us that we cannot do this alone. We have to do it with together with other people, with other disciplines, with patients and family members. Yeah, thank you. Good example. Okay. So now we have a short break until 10 minutes after 3:15 or 10. Take a cup of tea or whatever, and we'll be back in 6 minutes. See you at 15:10. Okay. Welcome back, everybody. We'll go on with the contribution from Norway. In fact, in 2015, we had a conference in Oslo, Norway, led by Torleif Ruud and his colleagues, Tor Helge and others. And we'll see the movie, and afterwards, Margaret will lead the panel. Please, the movie.
6 years ago, we had the third European Congress on Assertive Outreach in Oslo in 2015. And since that time, there have been further developments of the community-based mental health services in Norway, both in primary care and in the specialized mental health services. While most of the patients seen by the community mental health centers are seen in outpatient clinics, the largest increase during the last years have been in mobile teams. And among these, we find the crisis resolution teams, early interventions teams, and rehabilitation teams for people with psychosis. And the largest group of these teams now are FACT teams that are developed during the last years.
We have about 70 FACT teams and 8 ACT teams in Norway. In recent years, we have established FACT teams for elderly, for persons with substance use disorders. We have forensic FACT teams, and at the moment, the health authorities are piloting FACT for young people. FACT teams in Norway are organized as a binding collaboration between district psychiatric centers and municipalities. Results from the research-based evaluation of the 7 first FACT teams show improvements with regard to quality of life, with regard to meaningful daily activities, financial situation, the living situation with less homelessness, with everyday practical and social functioning, and symptom reduction with regard to anxiety and depressive symptoms, and also severity of alcohol use.
Jeg har fått veldig god hjelp av FACT-team fra å ligge, være mest sengeliggende, ikke ha noe særlig livskvalitet, overmedisinert. Jeg var veldig stresset, hadde mye uro. Sakte, men sikkert med samtaler har jeg fått livskvalitet tilbake. Og nå har jeg et helt annet liv. Jeg står opp om morgenen, jeg har mange aktiviteter. Jeg føler mestring, livsmestring. Jeg til og med gifta meg. Det har vært en prosess da, som har gått over flere år. Men jeg må si jeg er kjempetakknemlig. Jeg har det veldig bra i dag.
Jeg føler meg beæret som får lov å bli med på den reisen deres. Og se at de opplever selv hverdagen sin bedre.
The main bulk of community mental health services in Norway are situated in each of the 365 municipalities we have. They focus on housing, economy, meaningful activities like individual job programs like individual placement and support. They focus on social inclusion, often in cooperation with the voluntary sector, and also specific treatment programs. This is not exclusively something for the specialist services. They also have intensive collaboration with the GPs, in particular concerning somatic health, which has come to greater awareness in the recent years.
Det den opplevelsen av å bli invitert inn i livet til brukerne, og få lov å være med på deres reise, være med på deres prosess mot å skape endring i livet. Det å se at de opplever mestring, det å være vitne til hvor lite som egentlig skal til.
Deltagelse på alle livets arenaer er sentralt for menneskers psykiske helse, og det å stå utenfor skole, arbeid og samfunnsliv er en dårlig forutsetning for god helse. Det er godt folkehelsearbeid å gi mennesker en mulighet til å stå i arbeidslivet. Vi må tørre å tenke utenfor boksen. Vi må være tilgjengelig og tilpasningsdyktig for å finne metoder slik at vi når alle dem som sliter.
There is still friction between the specialist services and the municipalities on at least 3 topics. One is, who are the experts? Secondly, what should be the focus on the services? And thirdly, to move resources and focus in the specialist services from inpatient treatment and outpatient clinics to joint outreach services in collaboration with the municipalities.
There is a growth in patient-centered care in both hospitals and other health services, and there's also an increasing awareness of involvement of family members, including children of patients. Other wishes are to have a more patient-centered mental health care, which includes having emphasis on shared decision-making and more emphasis on personal recovery. Easier access to the mental health services is still needed, but it's equally important to have good enough time, both in intensity and duration, to develop trust and a relationship between the service user and the service provider, so that this can lead to a better life for the service user.
Margaret.
Yes. Let me see, start my video. Yes. Okay, thanks a lot, Torleif. And is Tor Helge not there yet, or is he? I can't see him. Hi, Stefano. Yeah.
Good afternoon.
Good afternoon. Yes. Torleif, yeah, I think
I can hear you.
Yeah, you can hear me. I can't see you yet.
No, my picture is not there yet.
No. Maybe you have to press your camera button.
No.
Oh, yeah, now. Yeah. Oh, great to see you. Yes. Well, really, we are really thankful for also a beautiful movie from Norway. It's always great to see your beautiful country. It's almost as beautiful as Spain and Italy, of course, and much nicer than the Netherlands, with all the mountains and the Great Lakes and the fjords. Yeah, I also was very impressed about all the developments that have taken place in Norway, because I remember when you first you visited together with Niels and me the conference in Avilés, I think you joined us. Oh no, the preparations for the conference, you know. I'm sure you remember it, where we had this very late dinner, late at night, and we were not used to that. Then I think you struggled a lot in Norway with the development of community mental health care. So, well, I sent you already the questions we were going to ask, and I really like to know from you, and you told us a little bit about it in the movie, of course. What was the payoff of organizing the congress in Oslo? What was the main payoff for you or for Norway?
Yeah.
And hello, Tor. I see you now.
Okay, so Tor Helge is joining us.
Yeah.
Because I was expecting Tor Helge to be available on the screen as well, but
yeah.
He will be, yeah.
Yeah, he's there.
Well, I think regarding the conference in 2015, of course, Norway was in a stage of developing or further developing mental health services. We had community mental health centers and many things, but the greatest development during the last 10 years, including before that conference, has been development of mobile teams. So the number of people, professionals working in mobile teams have increased much more than the number working in ordinary outpatient clinics in mental health. And it's very, of course, since we were in the process, it's difficult to know exactly what came out of the conference because all these input are mixed in a way. But I think the development and growth of many FACT teams has been at least partly influenced by the conference, because in the conference people could meet many people working with fact teams and so on and hear about it. And of course, when the conference is in a country, there are many more people joining or participating in the Congress than usual, because it's in their country and close. So we had the benefit of many Norwegians participating that also could bring back to their work and their home the influences and the things I heard about. And I think it was very many inspiring and important presentations and discussions during the conference we had in Oslo that influenced us and also increased the contact by the network for many people in Norway with people in other countries. And one event that was mentioned earlier here is that we had this breakfast meeting on starting UCOMS.
Yeah.
And Tor Helge and others have been involved in UCOMS through the years, and there is an increasing emphasis on exchange of experiences, as Nils mentioned. So I think that is also one important thing that happened during that conference in Oslo.
Yeah, I think so too. It was really inspiring. So Helge, can you tell a little bit more about what you, because you are directly involved with the fact teams in Oslo?
Yes.
Can you add something to that?
Yes, it was very useful to have the conference in Oslo, because there were a few ACT teams, and we started the first fact team late in 2013. So it was very useful for the new fact teams and the start of and the beginning of the new fact teams. So that was very useful. And the EOF, congratulations to the 10 years anniversary.
Yay,
Yes,
thank you.
this conference is the best conference for me. It's my area, and assertive outreach, that's the future. So good job. And that was very good to have it in Oslo. So good job, Torleif. And we also had the symposium of fact and with the Swedes. And then we met the Danish people, the Nordic collaboration with implementation and research. So very good.
Okay, thank you. Stefano, you also prepared some questions, or one question, I'm
Yes.
not sure. Can you?
First of all, I would like just to say that I'm very happy to participate at the discussion after your movie, because during the last Congress, I was really impressed by the presentation about Youth Arena in Oslo. And I took a lot of examples about how to involve the young patients, because I work mostly with eating disorders, so a lot of adolescents, young adults. And I was really impressed how you get them involved, how they feel at the center of the therapy. And so thank you for that. And regarding the question, I would like to ask you what are your most important goals for the next future. So what do you expect to achieve in the next period? Thank you.
Yes, I think we are going to achieve more digital outreach for young people, and we have practiced it in this pandemic. And also Youth Arena is also good on that, on digital outreach to the young people and adolescents. So there's the success, and they also, I hope for the Youth Arena model that they catch boys and young men, and they have done that. And early intervention, low threshold, and no wrong door policy. So good job. And now they've started also Fact Youth in my district. So I'm curious to see the collaboration between Youth Arena and Fact Youth in my district. So that's curious to see the future. And more peer workers in the services, Youth Arena and Fact Youth, they have peer workers, peer specialists. And in the future, more focus on learning from each other with UCOMS, EOF, and it's a shame we didn't go to Leuven, Belgium, but then 2023 we can meet again, Stefano.
Thank you very much.
Yeah. There are also some questions in the chat. One is about the attention for homeless people, because I also was a little bit surprised when we visited Oslo and we had a conference that there were so many homeless people in Oslo in the public space. And back then I already thought, well, what about these people? Do they get some attention from the FAC teams or the ACT teams? Later on I learned that they do a good work in the ACT teams, but to Helge or Tolev, I don't know who knows the most about it. Is there increasing attention for homeless people in Norway?
No, I don't think that is an increasing problem, but there are some people, of course, but not, we don't, even Oslo is not such a big city as many other big cities, so there may be some, there are some, but they are more concentrated in a way. But I think the social services is doing a lot, and also many NGOs, many private organizations are doing many things. I think also the like FAC teams and FAC teams could do more, but I think they are more brought into this by the social services, other services. So it's especially not a big attention, but it's and it could have been more attention, but I think there are much work going on, but perhaps not always by the ordinary mental health services.
Okay, because also in the movie it was said there was a distinction between the work that community services deliver and the specialized work from the FAC teams, I believe, and there's a little bit of tension between that. Is that also related to the homeless people, maybe?
Well, I think it's more a basic problem, because the one thing there is in Norway that's a problem is a financial split. Because the primary care is funded through the municipalities and the mental health care through the health trusts.
Yeah, okay.
So I think it would be, we still need to improve the collaboration between these two levels of care to make it one. And I think it's slowly improving, but there is a problem with because then all of services are required by health authorities to do different things, and like it's encouraged in words to do more collaboration, but the financial system is not rewarding collaboration in a way. So we have to be able to solve that more, I think, better.
Yeah, okay. Yeah, that's an important issue, of course. And maybe also in regard to the forensic FAC team, because in the movie you said you were developing the forensic FAC team. Is there also this financial problem? And
it's probably the same, because we have this split, but one special thing in Norway, like in many countries, I think the FAC teams, ACT teams are part of them specialized mental health care, or there is no such big distinction. But in Norway, they are required to cooperate or to be part of both the primary care and the specialized mental care. So the ACT team was in a way a new way to try to integrate these two levels. And the FAC teams, I think, seems to be following the same rules given by the government to give support.
Yeah, okay, okay.
Yes, but we have been struggling quite a bit in the city of Oslo to integrate housing first in fact and in the services. But like Juan just said and Nils said, it takes years. You have to fight and fight and fight. Yeah.
Yeah, of course. Yeah. And I think in Gamle Oslo, where your teams are, I think there's a lot of problems with people with severe mental illness. So you see all the problems, I think. So maybe the struggle there is even more important, or it's even more important to collaborate on all these financial levels. Yeah.
Yes. surveys like user plan, as I call it, brukerplan. So it indicates that the inner parts of Oslo, the high portions of severe mental illness and substance use disorder and homeless. Yes.
Yeah. Okay. Thank you, Stefano. Do you have another question? We have a few minutes left. No. Okay. Well, thank you, Torleif and Helga and Stefano for your contribution. Really glad that you did it, and really nice to see you all. Niels, I think we can go on.
Thank you, Torleif, Helga, Stefano, Margaret, for this panel discussion and for the movie, which showed all the recent development, the last 8 to 10 years, that in Norway, there's really a transition going on from clinical inpatient to outpatient mental health care. They are developing so many teams, now even specialized FACT teams, ACT teams. They are really in a transform, which is now, I think, almost finished, not yet in terms of that it's ready, but there are so many FACT teams now spread out over the country. It's admirable that you reached this milestone. And there's now a lot of research going on into the effects, as Anna Landheim told us about, and this will be in publications in the coming years. So now we go on to the situation in Germany. Germany is a little bit of a complicated country, like many countries, and they have still a lot of focus on inpatient care. Outpatient care is improving, but the conference was in Hamburg, and the conference in Hamburg was in part organized by the clinic. And the movies that they wanted to make, this movie had to be in the clinic because there many of the work takes place, and the clinic did not allow the people there to make a movie because of COVID. So there's an excuse from Hamburg people that they were not able to show this movie. And as I heard from different sources in Germany, they're still very much struggling with setting up outpatient care. There are some initiatives spread out through the country, but it's difficult. There's a lot of focus on inpatient care still, also in Germany. We'll hear from them probably, hopefully in Leuven in 2 years. And well, I wish them luck, of course, with all the developments. So then we go on to Italy, where we had the last conference in 2019. This also was a very successful conference in terms that we had lots of presentations from different countries. And we were very happy to have this conference hosted by the Italian people, because, of course, for community mental health service, Italy has always been an example for many of us. Trieste, but also Verona, with its large tradition in community psychiatry. So Mirella Ruggeri, who chaired the conference back then, she sends us a movie with a presentation of her work of the last years, her and her colleagues, and then we'll talk about this in a panel together with Alessandra. So please, could you start the Italian contribution? Thank you.
Dear colleagues, it is really a pleasure to have been invited by the colleagues of the EAOF Association to make this short vision. I want to first say that I still remember with a lot of pleasure the experience we have in preparing the 2019 Verona Congress and the title that we wanted to give to this Congress, Shaping the Future of Community Mental Health Care. This Congress has been based also on the principles of the Italian psychiatric reform, in the intent to better disseminate some principles of the psychiatric reform. I expect that you all know in detail this reform, but I just want to highlight that it has been promoted in 1978, and since then our system of mental health care has been changed radically. There was a gradual phasing out of mental hospitals with the cessation of all new admissions. Psychiatric wards for acute admissions were in general hospitals with a maximum of 15 beds. Restriction of compulsory admission was radically kept with a maximum of 7 days of compulsory restriction for compulsory admission, with the mayor of the town that had to sign the appropriateness of the admission. And then the setting up of community mental health services providing psychiatric care to geographically defined areas. What happened more in detail? Healthcare was started to be provided by the National Health Service, and the regions carried out the duties through the local health authorities, and then departments of mental health were constituted, and then sub-areas, the community mental health services that were to use and serve about 100,000 catchment area inhabitants. And the department was responsible for coordinating all mental health services. In the network, there were a series of mandatory facilities, outpatient services, semi-residential services, day centers, residential services for more severely ill people, and services. But let me give you some details of this very important work that we did, the group of Verona with the group of EOF in 2019. What did we want to aim with this Congress? And I think that this Congress really promoted a series of key issues that are still very much on focus. Which were the issues that we wanted to highlight? How to favor prevention of mental illness, how implement integrated care for people with severe mental illness, how to facilitate the recovery process by providing mental health care in the community, and then how promote the institutionalization all over the Europe and possibly all over the world to decrease psychiatric hospital beds and better outpatient care in many countries. In the Congress, we want also to highlight that new treatments are now available and should be used, such as modern psychological treatments, digital psychiatry, new recovery-oriented approaches, and the fundamental introduction of peer experts. We were aware, going on and on in the presentations of the Congress, that we need better implementation of effective practices, better collaboration with consumers and significant others, more use of digital psychiatry, and interdisciplinary integration of various services. We also now know, thanks also to the acquirement get by this Congress, that prevention of mental illness in the community, especially for younger people, might be done successfully and has been practiced in some areas. But we also know that unfortunately, this is not applied so far, not everywhere, and not enough. And this is an input that I wish to give for the future of mental health care. At the end of this short video, I also want to highlight the numbers of the 2019 EOF Congress that prove the success of the Congress, not of us, but of the EOF people for what they did and for what I expect they will continue to do. We had 400 participants, 24 nations, 7 out of Europe. Now Lectio Magistralis on key themes like prevention, quality assessment, health policies, technical and organizational innovation of great interest. 32 symposia, 23 workshops, 2 master classes, 99 oral presentations, 25 posters. All these interventions were really very much focused on the issue of the future of mental health. In total, there were 302 presentations debating on the 8 priority themes of the conference. So I summarize them: the institutionalizations, interventions on the territory and with the community, recovery, digital psychiatry, psychiatric in the community for children and adolescents, evaluation of community services, prevention, integrated interventions and collaboration between mental health services and other services. So we believe, I believe, and we all believe, I think, that the work done together in the Verona Congress has set the floor for future improvements. Now we have to open a new era, and we have to do the best we can in order to achieve this kind of implementation and improvement of practice in mental health care. Thank you so much. Hope to see you all soon.
I'd like to give the floor to Marijke for the panel discussion on this one. Unfortunately, Mirella, she would have been here, but she was called by the board of directors for a meeting that she had to attend this afternoon. So she was not able to join us in the discussion. But as you can see from her presentation, even in Italy, where the outpatient mental health care has been so much developed over the last couple of years, they're still struggling with some essential issues, which are also not solved in Italy. And that gives hope for the countries that are also struggling, but these are important matters to try to solve in the future. Marijke, can I give the word to you?
Yes, thank you, Niels. Yeah, unfortunately, as Niels said, Mirella couldn't make it today, but yeah, we are very glad she made this video. She's a very busy woman, as we all are, but she is especially very busy. She had a congress, the congress the week before, so okay. And we had a very we have a very good we have, sorry?
A representative.
A representative, yes, that's the word I was looking for, thank you. And that is Alessandra Martinelli. You already met her because she is the president of the Young EOF. And she had a presentation at the start of this meeting. So she will represent Italy, Verona, and we have another sidekick also from the Young EOF, and that is Saskia de Haan. So she will help me, and of course you can ask a question in the questions in the chat. Alessandra, yeah, the same question for you. What has been the payoff of the Verona conference in 2019?
Hello again. And the payoff of the Congress, I was part, as you know, of the committee of the organization of that Congress. That for me, the payoff was huge personally, because it was a very new experience considering Verona, because the Verona, in particular Verona University, and by Professor Ruggeri, is really focused on evidence-based medicine and biopsychosocial model. So our way of work is in some way really focused on following guidelines, national guidelines, international above all, international guidelines. Here in Verona, there's the WHO Center for the psychopharmacology. So even the use of this treatment is very important. However, as you said, in Italy and in Verona, we have a very long history in community care. And so I think that for sure one of the payoff was the capacity of this Congress to join the research to the everyday practice, the clinical practice, involving in a conference not only psychiatrists, as frequently happen in these in congresses, but all the figures involved in mental health. And I think this was a great step, because this, for example, gave the opportunity for the first time in the history of Verona to users of our community to participate in an international congress. Of course, there was the problem of the language, but that one was a very important step, because it was like a brick in order to start to build also an association to represent themselves in the Department of Mental Health. Because in Verona, we don't have peer experts. We don't have users who can represent themselves and talk for themselves. So it was, I think that the most important payoff was that. And finally, talk about community care, not only on an Italian perspective, but also in a European perspective. And it's very enrichful, because in Italy, we have a long history, but we are not so all developed in terms of recovery in all in the whole Italian soil.
Okay, thank you. That's really a very important payoff. More recovery and the medical psychiatry more together, and also the expert by experience, the peers who have now more opportunity to be in the teams and maybe have an important role in Verona. Great. And well, Mirella said in her video, she talked about the issue of implementation, and that's the subject of the next conference. But maybe could you tell us about what you know about what's happening nowadays in Verona on these subjects she mentioned, like digital treatment, like more recovery oriented, as you also mentioned, and prevention, maybe young people also. Can you tell a little bit about how it's about these issues now?
Of course. Here in Verona, there are projects about each topic you mentioned and that Professor Ruggeri mentioned. For recovery, as I said, that this group of users who are trying to become an association to represent themselves and evolve in peer experts. So there are some educational and or courses, for example, about this topic, and to help the users to become peer experts, and so to overcome even a perspective of being in some way addicted to institutions. And so this is for recovery. According to digital psychiatry, okay, I have to say that it became, as I think all over Europe, very common using these digital online meetings because of the pandemics. And so it obliged in some ways also all the community care in which we work to improve this type of work, However, the area in which digital psychiatry is more used here in Verona is in cognitive rehabilitation. There's a very huge use of mobile applications and computers to improve the cognition of patients. And then, according to prevention, I have to say that this is the topic that is the most important one, maybe in this moment, for Professor Ruggeri, because she is developing really a lot of projects related to act as soon as possible in very young people. So from working with the sensibilization in schools, then there are projects also to create, according to try to create a liaison between the psychiatry for children and the psychiatry for adulthood, because in Italy there's a law that is mandatory to create this, but it's not so easy as it could seem. Even because in Italy we are 21 regions and each region has got a different organization, and so it's quite difficult.
Yeah. Thank you. It was a big question, so it was also a big answer. Thank you very much, and it's good to hear that a lot of things are happening now. Saskia, we have a few minutes more. So do you have a question for Alessandra?
Yes, thank you, Marijke, for the opportunity. Alessandra, it was a very interesting congress in Verona, and you had a great part in the organization. And I hear you talk about many goals and important developments that should take place, and few already have taken place. And I was wondering, from the many developments that have been there, but also the points that weren't arranged yet, what would be the most important goal for you for the next year or years?
A short answer.
Sorry. Okay, 2 words. I think empowerment and prevention. These are the 2 main focus.
Okay, great. Very important. Okay,
now,
then the last
a
point.
Much more about perhaps about the empowerment issue. A few words.
A few words, but she also has a question for us. So
okay, sorry.
Maybe because the last question is what you as the young professionals in Italy, how do they participate in this? And maybe you want to ask them about the next conference.
Yes, I have to say that in Italy there's not a movement, so we need to create it, and I think that the EOF is an opportunity. And as the president of the Young EOF, I ask to all the young professionals here really to join us, even considering the next Congress in Leuven 2023, because we are going to organize some symposia, and it will be great to have the chance to organize them among different countries on topics about community care and assertive outreach altogether. It was a great experience for me working with Saskia, Stefano, and Stefan, and so I really would like to increase the group to have all this great experience together.
Okay, so everybody who knows a young professional, psychiatrist, or peer expert,
nurses, support workers,
please, there we can put the email address again in the chat. Well, thank you very much, Alessandra. You did a very good job. So thank you very much, Saskia. And I give the word to Niels.
Thank you, Marijke, Alessandra, Saskia, and of course Mirella for sending her very interesting short movie with important issues she addressed. Then before I will give my last words, I'll give the floor to Ronnie Bruffaerts, Professor Ronnie Bruffaerts from Leuven, Belgium. We should have been with you, Ronnie, today, actually.
I know. It's such a pity that this is a virtual meeting, but anyway, good to see you, all of you.
Yes, good to see you. Thank you for creating the opportunity. Well, we'll meet each other certainly in 23 with hopefully everybody that attends now and others to have the meeting in Leuven about implementing the things that we all know. And I'll give you the floor to tell a little bit about this, the aims of the conference, and well, what you hope to achieve in Leuven in 2 years with a conference. Ronnie.
Thank you, Niels. This is probably the most difficult moment of the day because I'm going to try to share my screen. Niels or any one of the members, can I get the rights to share my screen? Thank you.
Yes, you're on.
Yeah, I'm trying to. Here we are. So good afternoon, everyone. It's a pleasure to be here, although it's a couple of minutes before 4, so don't rush into the weekend yet. I will just have a very small talk, but addressing some major points that we could get into, we can think of when we are in the weekend. I'm going to tell you something about the breaking barriers in 2021 in Belgium. And as Niels mentioned before, this is really something that we wanted to discuss at the Real Life Conference, September 21, now actually in Leuven, but we have to postpone it another 2 years. But this is really, situation in Belgium is really about breaking barriers. I'm going to tell you in a couple of limited number of slides, I'm going to tell you some crucial elements about this. Some facts on mental health care, 3 elements or 3 questions for this presentation: how mental health care was in Belgium, how it used to be, what the current changes are, and how it will be in the near future. I think if we summarize the state of the art in Belgium prior to the reforms and say 2011, it's not such a long time ago, but it's still 10 years. The main situation was that we headed in terms of the number of psychiatric beds, and with the number of psychiatric beds came the high number of hospitalizations, the long hospitalizations, even so, and I could say mostly for people who didn't need any hospitalization for their mental disorders. If we look at severity of mental disorders in hospitalizations, these are mostly mild to moderate mental disorders. And this is really a conclusion that holds for decades and decades of mental health care in Belgium. A largely inpatient-driven psychiatry, a lack of coordination, lack of continuity of care, not just inpatient, but also outpatient, leading to a high overmet need. People are treated in a very highly specialized way, even with low, mild, or no disorders at all. And remarkably, prior to 2019, there was no formal integration of clinical psychology or the clinical psychologist in the mental health care system. The issue was raised back in 2010, and by 2011, there was a plan of reforming mental health care along 5 central functions: primary care, mobile crisis team, rehabilitation, intensive inpatient care and specialized housing. But although the plan was issued in 2011, and I hope you can see my pointer, it was not until a couple of years ago that the real implementation took place. The reimbursed primary care psychologist became part of the healthcare system 2019, not 1919, but 2019, only two years ago. And whereas the high intensive care units started to develop in 2020. So you see that there's a difference in speed of implementation. The plan was settled and agreed upon in 2011, but it's only very recently that the real implementation took a considerable speed. The 32 community networks were established in 2019, and only a couple of months ago, the Minister of Public Health said, well, all future reforms should be done from a public health perspective. That's only a message that is a couple of months old. So if we summarize, what we've seen in Belgium is high unmet needs, high overmet needs. And so the whole idea of innovating the service delivery systems has a challenge in lowering thresholds for patients. So making the entrance to healthcare better and smoother on the one side, and on the other side, filtering these high overmet needs once people get into treatment. By 2015, this led to the idea that the patient is really at the center of his treatment. And I'm just copying, with his permission, I'm copying one slide of the Minister of Health dating back 2 days ago. So this is a very recent slide saying that the future healthcare reforms in mental health should start from a population perspective, should take into account patient experience, staff and carer well-being against the background of sustainable costs. And we are moving in a very high speed to a public health perspective. And when I was presenting this or a couple of elements of these discussions back in Verona, I knew at the last conference, I said, I hope that we will proceed with this public health perspective in Belgium. And yes, we do, at very high speed. And that brings us to a couple of important questions, not just from a scientific point of view, but also from a consumer and user point of view. Where and what are the unmet needs on the network level? Who will take responsibility? What is the effective quality of care that is provided to people? And with a large, in terms of healthcare provision, with a large emphasis on very low threshold community interventions, bringing treatment really into society. And really, this is really the first time in 25 years that is effectively happening. And these and all the other things I wanted to discuss at the Leuven meeting, but the pandemic made that we had to postpone another 2 years. And as you see, we make it happen. And without any doubt, in 2023, we will make it happen in the Leuven conference. So I would say thank you for being here. Before you rush into the weekend, there's a small promo film on how Leuven looks like, a very nice, cozy little town. And I think this is the exact good start to rush into the weekend. So take care, have a nice weekend, and we stay tuned, and we'll see each other in 2023, the latest.
Thank you very much. Thank you, Ronnie. Leuven in motion. We love Leuven. Thank you for your the important issues you addressed, the developments in Belgium, the role you play, Ronnie, in making this all possible, and all the efforts that you make to contribute to the services and implement all these things. We are looking very much forward to the conference in Leuven in 2 years. And I'll close this session by saying a few words what we learned today. It was in the Netherlands that they learned to integrate mental health and social services, what Jasper told. It was in Spain that they found the importance of home visits and to develop the community that they accept home visits. It was in Oslo that they told us about digital outreach. It was in Italy that they learned about the importance of having peer workers in the teams and having a peer worker association. And it is in Belgium that we heard a slow but steady increase in community work and moving towards a public mental health perspective. And I think the last thing is very important, because we can treat our patients, but it's even better to prevent that they become severely mentally ill patients, and therefore we have in the community. I would like to thank you all for participating, Ronnie for making time to show your presentation and the movie, and we are looking very much forward to seeing you in 2023 in Leuven. Thank you all very much. Bye-bye.
Thank you. Bye-bye. Take care, all of you.